Welcome to Vibrant Health Nutrition Center Introductory class. I'm so glad you're able to join us and that you can do it from anywhere in the world, which is really exciting for us to be able to share online for those of you who can't get out or those of you who can't get to us locally. We're very happy to be able to serve you in this way. So again, welcome. Here's what we're going to cover. We're going to expose you to the philosophies and the principles behind what and how we do what we do, and more importantly, why we do what we do, and then how it helps you. What we don't do is diagnose, treat, prevent, or cure anything. We are not medical professionals. We are health professionals. Here's our story. Many years ago, when our family was very young, we had 2 daughters. We actually had a lot of medical challenges or health challenges, and both of our daughters were sick with mysterious illnesses. I had been diagnosed with skin cancer and fibrocystic breast disease, as it was known back then, and my husband had high cholesterol and high blood pressure. So our family in total was on 7 medications, and 5 of those were for our children, just allergy related. And we had seen them, unfortunately, progressively get worse rather than better. And our youngest daughter, from the time she was 2 until she was 8, was sick nearly every day with a tummy ache or something worse. And they both had dark circles. It turns out they had these really severe allergies, but nobody could tell us why. Even with seeing the allergy specialist, they still didn't give us the answers that we were looking for. And drugs weren't what we were looking for, but we did them because we didn't know that we had other options. So I went to a seminar. It was at Anthony Robbins' Unleash the Power Within, and the 4th day was all about health and nutrition. And the one moment in that time that I remember the most during that day was when he said, if you know anybody with severe allergies, then listen up. And I was all ears. So I took lots of notes and I brought the information home. He had given us a 10-day challenge and said, if you'll eliminate all of the white things, white flour, white sugar, salt, dairy, and also eliminating meat and processed foods, just for 10 days, see what that does for you and your family. And I thought, well, oh my gosh, if I can't have all of those and I can't feed my family those, what am I supposed to feed them? Because I didn't know that there was much left. And in my head, I'm thinking, so we're going to eat rabbit food? And I was like a little overwhelmed by the very thought of eliminating all of those foods from our diet, because I thought that those were foods that were actually good for us. So I was giving the children dairy because we needed it for the strong, healthy teeth and bones and all of that stuff. Turns out those aren't as good information as we have been led to believe that they are. So, long story short, in those 10 days, we got off of 6 of 7 of those medications and have never taken them since. And that's when our daughter was 8 years old, our youngest. And she's now 25 years old. And she still has never taken those medications. None of us have. And the 7th one was a high blood pressure medication, which we couldn't just stop taking. And so we worked with our doctor, and within the first month of changing our diet, we were able to get off of every single medication that we had been taking or giving our children for years. And we had lost a combined total of 27 pounds in those 10 days, 13 of which were from me and 11 from my husband, and then our oldest daughter, who had lost 3 pounds as well. So it was life-changing for our family, health-wise and medically speaking. In addition to that, our energy soared. Our bowel habits, which I know most people don't like to talk about, but it's essential for vibrant health to have good elimination. Our habits there had changed drastically. Our energy skyrocketed. We got better sleep. We woke up with boundless energy, and it was without, it was before that morning cup of coffee that my husband might have had, or me just kind of dragging myself out of bed. I was like, oh my gosh, I can like spring out of bed. This is so incredible. And our children started feeling better and better and better. And lo and behold, the dark circles under their eyes, those started to go away. And so our body was processing things so much better. And we also did proper food combining, which I believe made the difference. So it was a great healthy diet, lots of good, healthy, clean food. And we did proper food combining. And so what we thought was a need for medication went away, and we actually just needed to bring in live, healthy foods that were quality nutrients that we could perform properly and function at our optimum. So that's our story, and we can all do this for ourselves. We needed to know what we could do, and then we started to do it. And you can do this for yourself as well. We looked for ways to heal that were non-invasive, non-toxic, so they didn't have any nasty side effects or leading to more medications. One of the medications that our daughter was on was because of the side effects of the other medications that caused nausea. They were leading to the causes of other illnesses, and we didn't want that anymore. We also wanted to make sure that they were non-habit forming and that there were no negative side effects. So what about you? Have you experienced anything like that yourself? You've got a story like that, or you know someone who does. And that's why you're here, looking at this right now. So here's modern medicine and our philosophy on it. They do a phenomenal job. I mean, the best in the world at acute illnesses. They are number one. They save lives every moment of every day, and I thank God that they're there. Here's where the real challenge comes in, because they do not do a good job with chronic illnesses. Modern medicine is unfortunately lousy at helping you to restore function and restore your health. They use the same procedures to treat chronic care as they do for emergency medicine, and that's drugs and scalpels. There's a miserable failure for chronic illness in modern medicine. Otherwise, you wouldn't be here looking at this now if it had worked for you. Modern medicine is not traditional or conventional, and it's not historically proven valid. It's a pharmaceutically driven model for chronic illness care. It's not a model that works, and if it had, the numbers would be getting lower rather than increasing. And modern medicine cares for the illness, but not the person. And it misguides, misinforms, misleads about what's true and what's true health in our country. And unfortunately, the education for modern medicine does the same thing, which is why it leads to the modern medical professionals in giving us the same information that they've been taught, because they've been led to believe that it's factual. So I hope to open your eyes and for you to have some aha moments about what is possible for you when you take control and responsibility for your health. And I want to be a good guide for you, like I've been for many other people for nearly 20 years. We also needed something that wouldn't harm our family and would help us to get well. So we encourage you to look at natural first. Original remedies and original care, that's original medicine, not modern care. Here's our how we do what we do. We look at things from a perspective of different principles. So we have a foundation of principles that you need to be aware of and mostly agree with and see the value in and be willing to use as you begin this very special journey into natural health. And you've probably heard some or a lot of this, and for some of you it might be brand new. It's a new way of thinking, it's a new way of looking at things. Either way, I'm really glad that you're here, because we can actually take responsibility and control of our health, and we want to help you do the same. We certainly have a lot of influence over our health and how our bodies perform, right? So let's take advantage of that. Here are the 5 key principles that we have as our foundation. Our process, you don't need to agree 100%, but you do need to be aware of it. And our how we do what we do. Number 1, getting healthy is a process. It's not an event. So you can attend events like this online or in person and they'll help, but they are not the event. So it's a marathon, not a sprint. We don't function from the take a pill for the ill. That doesn't work. It's something that takes time and an investment of resources. So in order to heal, it takes 3 to 6 months to get stable and 1 to 3 years to get well. There's no way around it. I've looked far and wide, and what we need to do is understand that you're taking a body that has been misused or mistreated, intentional or otherwise, with the choices that we've made, And we're trying to erase 20, 30, 40 plus years of stress from your diet, your lifestyle, from smoking or drinking or not sleeping well, or toxic environments. So our air, our food pollutants, our water pollutants, and on and on and on. And we're trying to help our body to erase those. And it's not going to happen in days, weeks, or months. It's going to take years. It takes time to undo decades of self-abuse. So here's principle number 2, why we experience illnesses or dis-ease, as I like to refer to it as. It's because there's an absence of something that the body wishes was present. So the right nutrient, the right essential fatty acids, the right enzymes, and so on. Or it's the presence of something the body wishes was absent, such as food sensitivities, a scar topically on the body or internally, a metal or a chemical toxicity, or some kind of immune challenge or immune system weakness that's allowing the chronic recurrence or illness, or recurring infections, those types of things. So basically, there's 2 things: the absence of something that the body wishes was there, or the presence of something the body wishes wasn't there. These are just some of the things that we find through evaluation and determining the right course of action. So then we educate you in the process of getting well. So we have some agreement and some challenges with modern medicine. Modern medicine agrees that there's the absence and the presence. The challenge is they only use 2 approaches to address the absence or presence of what should or shouldn't be in the human body. So there's something missing, right? This is how they look at it. There's something missing, so they write a script for a drug. So that, for instance, might be if you have an allergy, that equals a claritin deficiency. Or if you have what they call an appendage problem, they just cut it out, right? Kind of scary in my opinion, and that doesn't work. We have all of these appendages for a reason. We don't take the approach of the this-that syndrome. If you have this, then that's the drug or procedure that you need. Traditional care looks at it from a different perspective. We're looking for the cause of the symptoms to help those symptoms, and holistic approaches to care to specifically meet your needs because you're different than everyone else. Principle number 3, the where, the what, and the how. Where's the stress? What's causing it? And how do we clear it? Without these answers, there is absolutely no legitimate solution. Disease management is not health care. Disease management is not health restoration. It's not an improvement or normalizing of performance in the body the way that it was designed to function. Principle number 4, our body's blueprint. Your body's blueprint. We're going to use your body's blueprint to figure out where you have challenges and how to educate you on them, and then how to help your body heal itself. And that blueprint is called your nervous system. It can bring on display or reveal to us where the stress is, what's causing it, and how to clear it. And we can do this in a non-toxic, non-invasive, and non-habit forming way, which is essential to true health. Principle number 5, we're talking about order, the thing, the amount, and the time. We need the right order, the right thing, in the right amount, at the right time, according, again, to your body's blueprint. So we want to find out also, are we a good match? This class is to see where you're at in your readiness to get well. Will you be a good match for us, and am I a good match for you? Those are 2 very important things because there's 2 things at stake: your health and my reputation or our reputation as a business. Neither one of those do I want to compromise in any way, shape, or form. So here's what you need to know in understanding your initial visits. There's going to be a pre-visit, and this is going to be paperwork that we'll give you to take home. It takes about 30 to 45 minutes to fill out because we want you to be very thoughtful about it when you're doing it so that we can help you the best. And you're going to get, on your first visit, there's going to be a 2-page case history. We may even send that home with you in the beginning. And this just shows me what you've done to yourself in the name of healthcare and what you've allowed others to do to you in the name of healthcare. So this helps us to know what to investigate, and it gives us a good case history that leads us to a good outcome for your future health. There's a system survey that takes about 15 minutes of those 45 minutes, and it helps us to understand what's going on according to what you're experiencing. Is it mild, moderate, or severe? And remember, symptoms are not illness. Symptoms are just symptoms. They're the body's inability to perform. For instance, acid reflux is not a disease, it's a symptom. Headaches, symptom. Same thing with anything else that you've got going on. And so a stomachache, symptom. Thyroid condition, symptom. But modern medicine says that you need to treat the symptom. Traditional care or original care says that no, we need to identify the cause, handle it to allow the body to perform properly, and then the symptoms go away. These just point me in the right direction of where to begin to look for the stress, not how to clear it yet, but then I know, is your thyroid, adrenals, cardiac, digestion, endocrine system, whatever, is that what we're dealing with? And that's what's dealing with the brunt of the lack of performance, and so on. So the next piece of the puzzle is what's called an HRV, or a heart rate variability test. It takes about 5 minutes, and it's a stress test that anyone can do. As long as you're able to stand up and lie down, then you can perform this. This reveals to me your body's blueprint, or your autonomic nervous system, referred to also as the ANS. It tells me, will you respond predictably to the right therapeutic agent? And how is your body dealing with stress? Is it stuck or confused in any way that might make designing a therapy for you very challenging, or would you respond at all? These are essential things that we need to know. That's why we start there. We get your case history, we understand where your nervous system is at, and then we can move forward appropriately. We need to know how your body will respond. We do this through nutritional kinesiology, also called muscle testing. There's several different forms of it. So it's applied kinesiology, clinical kinesiology, biokinesiology, nutrition response testing, and so on. There are multiple forms of nutrition or of kinesiology itself, and I use nutritional kinesiology, which is a blend of things that my mentor kind of put together, what he found over his 20 years experience and over 10,000 clinical hours, to put this program and call it nutritional kinesiology together, so that we can help identify your body's nutritional needs in a non-invasive way and a very rapid way, actually. So it tells me the where, the what, and the how, so that I can identify in the right order, based on your nervous system, what will help you individually. We're not doing things to you, but we're doing things with you in the right order that your body wants them done, so that it can restore optimal function and performance. For example, the liver wants attention. There are about 18 things that can affect your system's performance. Here are the top 5. 1, food. We don't eat the best foods to fuel our body's performance, unfortunately. So do you have food sensitivities? And I'm not referring to allergies per se. I'm talking about food sensitivities. And we don't identify allergies for anyone. So if you're looking for a diagnosis or treatment, we don't do either of those. That would mean that you're in the wrong place. That's where modern medicine comes in. So what we do is we evaluate your current status, find out why your body is not performing optimally, and then begin the process of removing the things that shouldn't be there, adding the ones that should, and in a very non-invasive, non-toxic, non-habit-forming way with no side effects. That is the ultimate in advanced care. By the way, you could have gone to an allergist and they said that you have an allergy, which is fine, that's your body's way of releasing something that actually says that there's a challenge with it systemically. But you may not have had the same result with a food sensitivity, but you might still have that food sensitivity. So we're going to look for not just what they might say that you have an allergy to, but also what might you be sensitive to that didn't reveal itself in an allergy test. All right, so here's number 2, your immune system. Most people suffer from a weakness in their immune system that's actually perpetuating chronic, non-resolving, recurrent infections that modern medicine can't help them get over. These could be parasites, yeast or fungus. They could be bacterial or viral as well, all just symptoms of the problem. Modern medicine says that those are the problem. Traditional care says no, you have an immune system that needs to be supported. Build your immune system up, and then symptoms diminish and go away on their own. That's by supporting your body properly. Again, it's the absence or presence philosophy. Number 3 and 4 are combined, so these are where chemical or metal toxicities can come in. And our bodies, by design, should be able to get rid of them, but when they're not functioning properly, they can't. So the problem is the last 100 to 150 years, our air, our water, and food pollutants are at an all-time high, and we're getting worse, not better. So we're getting overwhelmed by these toxins. Our bodies can't handle them fast enough, and so they become a problem. In fact, the third leading cause of illness, according to an EPA study, is metal and chemical poisoning accumulated from our environments. So again, air, water, or food pollutants. We can successfully identify these substances, not with biopsy, but with nutritional kinesiology that will bring on the display of the nervous system if there's anything that has any type of activity in there. And then we can help you clear it. Number 5, scars. Topical scars on the body. Doctors will go in and they'll cut out the scar tissue that's built up. Unfortunately, this creates more scar tissue. Or they'll take a syringe and a needle and inject lidocaine or procaine to shut it down. So we have these enzymes that produce fibrosis in the body, which is meant to heal and close scars or wounds. But if it's overactive and not functioning properly because of an imbalance in our nervous system, then it can cause an overactive scar tissue buildup. So the challenge is our body's not functioning properly. That's no way to actually get the best result. So what we do is understand that just as important as food are these other top 5 performance disruptors. So most people have one or more of these things that are actually happening right now, and that's why they can't get well. I had a health challenge for 25 years, and I tried every diet, I tried every supplement, I tried every medicine that was out there to help my body to stop having stabbing pain every time I ate any kind of food. And it took 25 years for me to understand that I also had to take care of, and I was already taking care of the structural side of things, the muscular side of things, and the nutritional side of things, but I wasn't taking care of the nervous system side of things. And until I understood that, my body was not allowing me to get well. And when I did, it started to change rapidly. Not all things respond that well, but for me, it did. So here's what's going to happen on your second visit. We're going to present you with a POC, otherwise known as a program of care. That's about 4.5 pages of care. And we'll go over that with you. And what it does is it educates you as to the process of how we monitor your case individually, how long it might take, what your investment of time and money could be, and all of that, just so that you know up front where there's nothing that's going to be hidden from you or that will surprise you with. You will know right up front how things are going to progress with you, financially, time-wise, and what your part's going to be. There's no guessing here. And then there's some fine-tuning, a healing observation, and a maintenance phase. These are the 3 phases that we'll talk about in your program of care and how that's going to help you. So here, let's cover them individually just kind of briefly. Fine-tuning, you're going to come in once a week for the first 4 to 6 weeks. It's going to be a full 15-minute visit. Versus, unfortunately, at your doctor's office, you're going to get 3 to 5 minutes, and it's not because that's what they want, it's what they're required to do. They have, unfortunately, quotas to meet with insurance companies, and so they're regulated heavily, and they don't get to spend the time with you that they would probably prefer to be able to spend time with on you and on your case individually. So don't be mad at them, be mad at the system. In fact, speak out about it. We encourage you to do that. Then we redo your nutritional kinesiology every time that we see you to see if there's new layers of stress that are coming up or showing up. And this is the most effective and most affordable way to get quality of care that's accessible and that you can afford. Here's where, in this phase, you should expect a 50% or greater improvement in terms of stress reduction. In fact, we've had people in this phase get 80% improvement. But not everybody's the same. They're following the protocol and the plan of care that we've designed for them very closely, and they're excelling quickly. Here's your part of each visit. First and foremost, we want you to do food logs. Now, I don't want you to cringe when you see this or hear it because we view them differently than you might think that we do. We don't use it as a way to determine what you shouldn't be eating, but rather we're identifying what you're not eating that you should be. And so it's that absence presence thing again. So what's missing in your diet that we could add to it? Not, hey, stop eating that because it's making you sick. Well, how about start eating this, and then when you start incorporating those things, you'll automatically and organically start eating the right things, because your body will start craving the things that are good for you. So also, what could you do to improve the quality of fuels equals the quality of performance that you should be expecting from your body. And it all starts here. Secondly, healing and observation. This is our second phase. You'll come in once every couple of weeks for at least 3 visits. And then this is where you'll know you're improving and your program is stable, your food logs are on point, you're taking advantage of the additional classes and education that we offer, you're developing new disciplines, you're positioning yourself for long-term gains without needing to see us as often. And that's our goal for you, is to just get to a phase that we call the maintenance phase, so that your body is functioning on its own properly. And this is all very key. It's all designed in a way that's going to help you perform optimally over an extended period of time. And here's where you should be able to say, I've achieved 75% or greater improvement in my health overall. Phase 3 is the maintenance phase. This is where you'll come in once every 4 weeks, then once every 6 weeks, then every 8 weeks, and then every 12 weeks. And you've got all of your disciplines of your new lifestyle in place. We've seen it consistently. You've experienced it consistently. We know that you're on the right track. And because we want to be there for you, we're going to give you your birthday and your anniversary visits as a compliment to you from us. So the other 2 you pay for. Now we're equally invested in your health. You should also expect 90% or more of what brought you in here to be diminished or gone. You will understand the process and how to keep yourself healthy and happy. I'm so happy for you that you're even on this page and you've gotten this far into the introductory class and you haven't shut your computer off or your phone off or whatever it is that you're looking at it on, because you're serious about your health. You're the kind of person that we know that we can help when you get to this point. Your body will be so happy that you came to this class and that you started on your healing journey to enjoying vibrant health naturally. All right, so let's talk about the fees. So our office visits are $40 per visit. If you're a veteran, a senior, or you're in the healing art, so medical or holistic side of things, then we're going to give you a discount for that. And children are always $35 or less if they have a parent also on a program of care with us. So monetarily speaking, we've made it and designed it specifically so that those of us, even without insurance, could afford to take advantage of these types of services, which are highly needed and desired by the population because they want to enjoy that vibrant health naturally. I'm excited to be able to offer these services to you at a price that you can afford. Nutritional therapy will come in if necessary, and that's going to actually be about $2 to $4 a day, sometimes less, sometimes a little bit more, and it's also going to depend on where you're at in your health. And so you can figure about $60 to $100 per month, give or take, in the beginning. And we strive for the smallest programs possible so that we can monitor them properly so that you get the best results. We have a motto at our office, and it is structured flexibility. And what that means is we have a structure that we offer and that we use and we work from, but we're very flexible with it depending on the individual, because you might be just stepping up to the base and other people might be rounding third base and still kind of stuck there and having challenges. So you're different than someone else might be. So we're flexible with what you've got going on so that you don't have to feel stressed about your program and you're still going to get results. So this is the most advanced form of care for restoring your health. Thank you for joining us. I'm so glad that you could be a part of what's going on in helping you to restore your body and your function and your joy even by feeling better and enjoying vibrant health naturally. That's what we're here for. We're here to help you, to support you, to be your cheerleader, and so on. There's a quote that I love by Hippocrates, who is the father of modern medicine. Interestingly enough, he said, "Let food be thy medicine, and medicine be thy food." So if you have any questions, feel free to post those in the comments, and then we'll address those individually and according to what you want. Or you can always call our office. The office number is 989-423-1027. And When you become a client with our office, I also will give you my personal cell phone number so that we can stay connected as much as we need to get you going, especially in the fine-tuning phase, to get you on track as fast as possible and to get you feeling well as fast as possible. So post your questions or comments, and if you've already started it and you're on a healing journey of your own prior to coming to us, share with us and others who are going to read these what you're excited about by working with us. If you're stuck, then we want to know so that we can help you there as well. Okay? Thank you so much for joining us. It's been an extraordinary pleasure and my joy and honor to serve you in this capacity, and I look forward to meeting you in person one day or by phone so that we can make the connections and start helping you to enjoy vibrant health naturally. Take care, friends. God bless.